Now there's something else that the body can do with tryptophan, and it's another pathway that leads to a substance which in fact is toxic for the neuron. And that pathway is increased when there's immune stimulation. Now the feeling of that is the feeling that people get when you have an acute, a bad episode of flu. You know, when you're aching all over and your energy is low and you don't want to get out of bed, and an acute viral infection is the effect of the immune stimulation changing the tryptophan to a substance which is neurotoxic. Probably has important implications in evolution. If you have an acute infection, your body probably should be resting so that you can use your energy to fight the infection. But when you live with a chronic infection, it can become a problem because in some people it could affect the mood. Now, when would that mechanism be too active, the mechanism that is creating the neurotoxin? If you have a high viral load, you have a lot of immune stimulation. And in fact, people with advanced HIV with high viral loads have been found to have more, commonly have depression. If you have two viruses, if you have both HIV and hepatitis C, you have more immune activation. Now, there's other reasons why people living with HIV can have more depression than people without HIV. Certain medications, for example, interferon, which is used to treat hepatitis C, is associated with a lot of depression. Steroids, which are used in certain conditions. Ephedrins, mostly associated with depression at the beginning of treatment. Then certain hormonal changes, changes in the thyroid gland, hypogonadism are more common in HIV and can lead to increased depression. I'm putting HIV dementia here on the list because HIV dementia can sometimes present as something that people will label a depression, because someone with dementia may not want to do anything, they may be difficult to mobilize, but in fact those people are not experiencing any sadness, so it is different from depression. Yes, dementia can be, there's a form of dementia that can be associated with advanced HIV. Now, I've presented one aspect of the depression, which is to look at the serotonin. There are many other pathways, very biological pathways that can lead to depression or prevent against depression. So I've talked about serotonin, I could talk about dopamine, about noradrenaline, and then some people are looking at factors that protect the brain. So it's a complex interactions of many substances. So the exact effect on depression and which severity of depression is not clear. Sometimes substances are very useful in mild to moderate depression, but then when you get to very severe depression, they're not as useful. Lower testosterone is associated with depression. Low testosterone is more common in HIV, and testosterone replacement can have an impact on mood and energy and stamina. That's a very good question. Usually, I mean, in these two pathways, under normal circumstances, there's a control. There has to be a gate that determines, you know, what's going to go where. And in fact, the control is here, is in the transformation from tryptophan to that neurotoxic substance. There's an enzyme here that blocks that, partially that pathway. And what happens is if you have immune stimulation, that enzyme is kind of unblocks that pathway. And what you see is that if you have an increased viral load, the tryptophan can drop by as much as 50 to 60%. What happens to people as the level drops? People, especially people who have a personal or family history of depression, and women especially, tend to develop a depression kind of acutely as the tryptophan is dropping. And then there's breakdown of proteins and the tryptophan starts going up and the depression lifts. So people who've had an episode of depression, if you do an acute tryptophan depletion test, their mood is going to get worse within hours and then gets better. Yes, it is. And it's only found in the diet. The body is able to, there's several amino acids that are necessary for protein synthesis, and the body is able to transform one into another for most amino acids except a few, and tryptophan is one of those. But tryptophan can be prescribed. 5-HTP, I think the transformation from that to tryptophan is not quite as effective. And tryptophan, the problem with tryptophan is that the pills are huge, like probably this big, and you need to take several pills to reach the therapeutic dose. So it's not very popular as an antidepressant, as compared to a small pill of SSRI.